ladies and gentlemen. Welcome to Donna Just Being Real. Alright, so we're going to get back into this trial again. Dusty Lowlife Nathaniel Rowland. Trial Day 5. Dr. Thomas Beaver, a forensic pathologist. Excuse me for saying it wrong. Alright, so we're going to get into this one, and this is on day 5. And then after this one, I'm going to skip. Well, I'm just going to play here with this day 5, but after that I'm going to show another video, and it's going to be the closing, when they have the defense closing and the prosecution's closing. So that'll be like the next video. So we wrap it up, then we can get to hear what the judge have to say. All right, this is very interesting. I love to hear closing out, don't you? I love it. All right, so make sure you hit the like button, share the video on your social media, and also share your thoughts and opinions in the comment section. What do you think? And at times I might pause a little bit to give my, share my thoughts, give my little commentary about this whole thing, this trifling person. Real quick, make sure you read the description so you can find out what's happening. Real quick, basically this Dusty Lowlife that you see right here, he act like he was some sort of Uber driver, and this lady right here, unfortunately, she got into his vehicle, and he stabbed her basically over 100 times. Evil monster. Alright, so we're going to get into, and then also I'm going to do a video that we're going to roast the parents. Let me show you the parents right here. His parents, they don't think their son did it. They don't think he did it. Sorry, he did it. Okay? Your son is a monster. Mommy and daddy laid down, and they had Satan Jr., and this is him right here. All right, ladies and gentlemen, let's get into this. But you know how we do with this. When we do the trials here, we pick up the speed. So right now I'm going to pick up the speed, and it's going to go to 1.25. Might change it up to 1.5, we'll see. But right now we're going to stick to 1.25. Now, if it's too fast for you on your end, what you do is you can just lower the speed, and it could be at the speed that's, that's better for you. But right here, we're going to stick to the 1.25. And like I said, hit the like, share it. And if you want to get in touch with me, you can find my email in the description. You can email me, have any video requests, or also if you need coaching in dating, love, and relationships, I'm here for you. Let's get it.
If any of you have been exposed to anything that affects your ability to be fair and impartial in this case, please raise your hand. All right. Very good. We'll press on. You may call your next witness.
State call Dr. Thomas Beaver.
Do you solemnly swear or affirm that the testimony about you in this case will be true, the whole truth, and nothing but the truth, so help you God? Please have a seat, state your full name for the record.
My name is Dr. Thomas Richard Beaver, B-E-A-V-E-R.
Good morning, Dr. Beaver.
Good morning.
What's your profession?
I'm a forensic pathologist.
And tell us what a forensic pathologist is.
Yes, forensic pathologist is a physician who has been specifically trained to determine the cause, manner, and mechanism of death in cases of unexplained death.
And are you a licensed physician?
Yes, sir.
In what states?
I'm licensed in the state of Florida, South Carolina, of course, California, and I didn't renew my West Virginia license this year, and I was previously licensed in Colorado, and I let that expire as well because it's expensive, and I don't practice there.
All right. And how long have you been a forensic pathologist?
I finished training in 1992 and went to work at that time as a forensic pathologist, so it'll be July of 92.
So roughly 29 years?
Yes, sir.
Can you tell me a little bit about your background, your education, things of that nature?
Certainly. I have an undergraduate degree from the University of California. I have a medical degree from St. George's University School of Medicine. I completed a 5-year residency training program in anatomic pathology and clinical pathology at the University of Colorado, and I completed a fellowship in forensic pathology at the Denver County Coroner's Office. I took the certifying examinations given by the American Board of Pathology in anatomic pathology, and clinical pathology, and forensic pathology, passing all those exams on the first attempt. So that makes me board certified in anatomic pathology, clinical pathology, and forensic pathology.
All right. And when you say board certified, I know you talked about these exams that you passed on the first attempt. Just what does that mean, I guess, in layman's terms, that you're board certified?
So before you can become board certified, you have to complete the requisite training program satisfactorily. So you have to, in my case, I did 5-year training program to get both anatomic and clinical pathology. Once you complete that training, then you're eligible to take the exam. So you take the exam. The pass rate is less than 50%. In the group of forensic pathologists that took the forensic pathology exam, it was about 50% was the pass rate. To pass all those exams on the first attempt is really unusual.
No, in your 29 years of being a forensic pathologist, have you received any awards? Or special recognition, any honors, things of that nature? Just
Yeah, so I was appointed to the Crime Lab Council in the state of Florida by the governor. And so that's about the only thing. I don't really seek awards or anything like that, so I don't really promote myself.
And what positions have you held just through your time as a forensic pathologist?
So my first job out of training, I was in a private practice pathology group in Modesto, California. And in that group I covered, I was the only forensic pathologist, so I covered all the counties of Central Florida, Central California. And it won't mean much to you, but it's Stanislaus County, Merced, Amador, Tuolumne, and Calaveras. Those are all little counties in the Central Valley. Modesto is the city, and that's where I would live. Then I moved to Florida, where I became the associate medical examiner in Panama City, Florida. I was there a little bit more than a year, and then I moved to the chief medical examiner position in Daytona Beach. Florida is a medical examiner state. It's divided up into districts, 25 districts. Each district gets a medical examiner appointed by the governor to a 3-year term. And so I was in Daytona Beach for almost 9 years. And then I took a teaching position at Texas Tech University, where I was the director of the Division of Forensic Sciences within the university. In that capacity, not only did I teach medical students and residents, which is what I do now, but I also was the director of their forensic science program, which included undergraduate track as well as a master's in forensic science.
Were you in California at some point in time?
Yes, so I was there about 3 years, then I went to California. My wife had a seizure, and it turned out to be brain cancer, and she wanted to be back home. And so we went to California, took care of her for a while, and then had to go back to work. And I took a position at Alameda County, I was the chief forensic pathologist in Alameda County.
And would that be the Oakland area?
That's Oakland, California, a big office. I had
Sure.
22 investigators. I had 8 technicians, 6 clerical staff. We never turned off the lights and never locked the door because we ran 24/7.
How long were you in that area, Alameda County?
Yeah, I was in Alameda County for about 3 years, and finished my kids all out of the nest, and they were all out on their own lives. And I decided to go back to Florida, and I took a job in the Florida Keys, and I was the medical examiner for District 16, which is the Florida Keys, the Monroe County.
No.
And
if I can, I'm going to kind of focus this now to South Carolina.
Sure, absolutely.
Sure. How long have you been in South Carolina?
Since June of 2018.
Okay, and what is your position here?
I'm an associate professor at Medical University of South Carolina.
Okay. And in the position as associate professor at MUSC, as I'll call it, you perform autopsies?
Yes, sir, I do.
What is an autopsy?
So an autopsy is an examination of the body externally and internally. It's a systematic examination, so there's certain things that we just do the same way every single time. Starts with the external, so we're looking on the surface of the body for evidence of therapy, scars and identifying marks, evidence of injury, and then just a general condition of the body. The internal examination, we make incisions on the body so that we can access all the body cavities and organs. The organs are removed individually and sequentially and dissected and biopsied. We take photographs the entire process, so every step of the way we take pictures. So,
and then I'll ask this question because we'll get a little bit more in depth in a couple minutes about that. Roughly how many autopsies have you performed in the last 29 years?
Oh, yes, sir. I don't keep a count, but it's probably 10,000, and it may be more.
Okay. Have you been declared as an expert in the field of forensic pathology?
Oh, yes, sir, I have.
Okay. In the multiple states where you practiced?
Yes, many times.
And in South Carolina as well?
Yes, sir.
All right. Your Honor, I'd like to offer Dr. Beaver as an expert in forensic pathology.
He is so qualified.
No, thank you. Now we can get into a few more specifics. Now, you were talking about kind of the methodology that you use when you perform autopsies.
Yes, sir.
And you talked about pictures a moment ago and just how in depth you kind of remove organs and how you kind of systematically go through that process, correct?
Yes, sir.
All right. Now, what I'll ask is this. With that methodology, you first said that you take pictures.
Yes.
Okay, and you detail, like you said, systematically the organs. And that's just the process that you go through in every autopsy.
Yes.
Why do you take pictures?
So the pictures are taken to document injuries. I think the old saying, "A picture is worth 1,000 words," probably is accurate here. And and it's oftentimes easier to show someone something than it is to explain it by words. Now with the availability of digital photography and very good cameras and easy storage, we take the photographs that we would, to explain what we see.
Did you have the, do you take x-rays?
Yes, sir, I do take x-rays. In this case, we took 13 x-rays.
Okay, well, and now we're going to focus on this case in just a moment, but you generally take x-rays as part of your process?
Yes, absolutely.
Okay. All right. Now let's focus then. Let's get to it. So did you have an opportunity to perform an autopsy on Samantha Josephson?
Yes, sir, I did.
All right. And the process that you talked about, that was what you followed as you performed that autopsy, is that correct?
Yes, sir.
All right. So tell us, let's start with photographs. You said you normally take photographs. Did you do that here?
Yes, sir.
Approximately how many photographs did you take?
170 photographs.
Okay. Why so many?
There were a lot of injuries.
And x-rays, I was just mentioning. Did you take x-rays?
Yes, sir.
Okay. How many?
I took 13 x-rays.
Why is that?
So we take x-rays in the case of gunshot wounds as well as stab wounds. And so I had initially seen sharp force injuries, stab wounds. So that makes me think that I need to take x-rays in this case. And I'm looking for perhaps pieces of the knife that have broken off. When the knife hits bone, it will either bend or break. So many times.
So you're saying steel will bend or break if it hits a bone?
Yes, if there's enough force applied and the knife blade is not sturdy enough, it will bend, or else maybe the tip will break off. When the tip breaks off, we can match that to a weapon if we recover it.
Now, as Ms. Josephson was presented to you in March of 2019, what was her body weight and height?
Yes, she was 69 inches tall, and she's weighed 160 pounds.
All right. And you alluded to some of this a moment ago. When she presented you, what was it that you saw that grasped your immediate attention?
There were two things first. The first thing was that she had an extensive amount of insect activity on the surface of the body. And the second thing, pretty much at the same time, was that she had many stab wounds over the surfaces of the body.
Now, you talked a moment ago about, you said sharp force injuries.
Yes, sir.
Okay, explain to the jury how you characterize sharp force injuries.
So in the universe of injuries for forensic pathologists, things are either blunt force or sharp force. And sharp force injuries are broken down into two types. Incised wounds, which are wounds that are longer than they are deep. So these would be, some people might refer to them as a scratch or a cut. And then there are stab wounds, and the stab wounds are deeper than they are wide or long. So these are wounds that where the knife has gone in, there's made a little cut in the skin, but the blade has gone deeper into the body. So
Would some people call those puncture wounds?
puncture wounds, yes, stab wounds. So I won't know, when I first see a sharp force injury, I won't know whether it's classified as a stab wound or an incised wound until I probe the wound and see how deep it goes.
All right. And when you probe the wound, explain to the jury what you mean by probing a wound.
So I have a metal probe that it's like a thin piece of metal, and I put that into the wound, and I try to follow the path of the wound, and then I mark the spot on the skin with my fingers by grasping it. And when I pull it out, I can then match it to a ruler, and I can see exactly how far the probe went in.
Now, again, you captured all of these things that you did by way of taking photographs. Is that correct?
Yes, sir.
And would that assist you in explaining to the jury, what you observed and why, and your findings as a result of what you observed?
Yes, sir.
Now, I'd like to first begin by showing you a series of pictures. And you talked about just kind of the methodology you use. As you performed this autopsy, did you, because of the number of stab wounds as you mentioned, did you do them in groupings? Did you try to group them differently than you normally would?
Yes, sir. Once the number gets up around 100, it really makes the autopsy report and any description very bulky. So I try to group them where they're closely together and related. So yes, I'll group them into groups of 5 or 6 or 8 in a certain area.
And you mentioned the number 100. Were you able to count the number of stab wounds as you observed Ms. Josephson's body?
Yes, it's over 100. I think somewhere around 120. But it gets to a point where it doesn't really add much to the report.
Courts and doses, Your Honor?
Yes, sir.
Now, let's, for purposes of just organization, I prefer to go, let's go head to toe.
Okay.
So that we can talk about some of these matters. I'm going to show you, and at this point I'll show them to you. You can, in my question to you, I'm just going to explain the process to make sure we're clear. Do not show these to the jury as I show them to you. I want you to tell me if you recognize them first, then we'll talk about them before we do any publishing of any pictures. Is that
I
the
understand.
process?
I understand.
All right. So, Your Honor, I'm going to approach the witness. They are states 347, states 346, states 342, and states 341.
Repeat that for me, please.
I'm sorry, 347, 346, 342, and 341.
Okay.
And do you recognize these photographs?
Yes, sir, I recognize these photos.
Okay, so let's start, if you'll start with the photograph on top. Please refer to that exhibit number, and let's just talk about what you observed in that photograph.
Okay, so I'm looking at exhibit number 341? 341?
Yes, sir.
And it's a photo taken at autopsy. The body is in the supine position.
What does
and
supine position mean?
Means face is up. Face is up in supine, and then prone, the face would be down. But she's laying on her back in this particular photograph.
Yes, sir.
And we're showing a close-up of the left side of her face. At the bottom of the frame is her left ear. Towards the left side of the frame is her chin. The eye and eyebrow are towards the upper right corner. And what we see in the center of the frame is her cheek. And on the cheek are a number of parallel cutaneous defects, which I would describe as abrasions. And they're abrasions that you would get if the body was dragged.
You used the word of term of art, cutaneous. What is cutaneous?
Cutaneous is just the skin. And
So you're seeing scratches on the skin is what you're suggesting?
yes, sir, I'm seeing scratches on the skin, and they're parallel scratches. So I think that the scratching surface that's scratching your skin is going in one direction, all going in one direction.
Okay, and that suggests the person's being dragged?
Yes, sir.
Okay. Now let's look at, again, not publishing to the jury yet. Let's look at the next picture of
So now I'm
report. Yeah, and explain again that exhibit number and tell us what you see in that picture.
Yes, sir. I'm looking at exhibit number 342. And this is another picture taken at the time of autopsy. Again, the body is in the supine position. It's a close-up photo, and it shows the right side of the head. To the extreme right lower corner is the right ear. Towards the left side of the frame is the top of the head. Towards the extreme upper right corner of the frame is the nose. And so in the center of the frame, we're looking at the right side of the forehead, the right eye, and right eyebrow.
And so what is it of, did you notice any defects to Ms. Josephson in those pictures?
Oh, yes, sir, there's many.
Now explain to the jury as another term of art what a defect is.
So a defect would be anything done to the skin that is not part of a normal process. So if I cut myself shaving, that would be a defect that I created. So it can be an abrasion from rubbing on the skin. It could be a stab wound. It could be a bruise. It could be a burn. So a defect is a very generic term for a number of different injuries that might have occurred to the skin.
So explain to the jury the defects, just without the picture, without the visual, but you can point yourself, if that will help at the moment, the defects that you observed when you performed this autopsy on Ms. Josephson, based on State's Exhibit number 342.
Yes, so she has bruising over the forehead and the right side of her face. She has a stab wound in the eyebrow. She has a number of other stab wounds on the right side of the face. And
May I interrupt you for a moment?
This man really is a devil. Wow. This poor woman, what she went through. Gosh. All right, ladies and gentlemen, resume. This is so sad. Resume.
You said a stab wound to the eyebrow.
Yes, sir.
Okay, so a moment ago you mentioned you take x-rays, correct?
Yes, sir.
And one of the reasons you take those, as you said, was to see if there may be damage to a weapon, to a knife?
Yes, sir. This is the primary reason. When I saw these stab wounds to the head, the skull is a very hard bone, very thick, and stabbing the skull frequently results in the knife bending or breaking. And so it immediately alerted me to take x-rays because we might have a piece of the knife actually embedded in the skull.
Thank you, sir. Please continue.
So I find that she also has an abrasion on the corner of the eye, and as I said, some bruising. The right eye is somewhat collapsed, and that's probably from some trauma to it. And then there's hemorrhaging to the periorbital tissues, the tissues around the eye. She's got a black eye, basically.
Now let's talk about that word you just mentioned just there, hemorrhaging. Is there a way to determine if wounds take place if a person is living or post-mortem when they're dead?
Yes, sir.
Okay, explain that and extravasated, I believe is the term that's used often. But explain those terms, sort of hemorrhaging versus extravasated to the jury, if you would, please.
Sure. So hemorrhage is an active process, and it requires a blood pressure. So when the person's alive, their heart's beating, they have a blood pressure. So all the blood vessels in the body are under a pressure, and the blood flows. Extravasated means that the blood has drained out of the blood vessel. So if we cut, say, a blood vessel and there's no blood pressure, blood will still drip out of it, but it's not under any kind of force. There's no hemorrhage going on. But if the person's got a blood pressure and you cut the blood vessel, then the blood will squirt out. It will be forcefully expelled from the blood vessel by the blood pressure. So it would kind of be like if you had a hose and the water was turned off and you cut the hose, you would expect a few drops of water to come out of the cut, but it wouldn't be much. If the hose was turned on and you cut it, then you would expect the water to come out forcefully. That's the difference between extravasated and hemorrhage.
All right. And so in this case, you said hemorrhaging?
Yes, sir. She has hemorrhage.
Okay. So it would suggest she was alive when these wounds were inflicted?
Yes, sir.
All right. So please continue as you were describing State's Exhibit number 342.
Ladies and gentlemen, you heard that? She was alive when these wounds were inflicted. So mommy, daddy, you don't think he did it, huh? Imagine her family right here have to hear this and know what their daughter went through. Her baby girl, his baby girl, her sister. Okay, ladies and gentlemen, resume.
There are also some wounds in the hair that we can see. And when I saw these wounds, I felt around in the hair. She has thick hair, and I could feel other wounds. So at that point, I know I'm going to have to remove some of the hair to get a good look at the wounds.
Did you do that in this case?
Yes, sir, I did.
And once you removed the hair, explain to the jury what you saw, just verbally. Explain what you saw.
So behind, on the right side of the head, behind and kind of above the right ear, there were multiple stab wounds.
Did you see anything else of interest in States 342 that you need to explain to the jury verbally?
No, sir, I think that's all.
Okay. Now let's turn to the next exhibit. Tell us again, just identify, do not publish that to the jury for a moment. What's the next picture you have in front of you?
Yes, sir, I'm looking now at 346.
So States 346. Take a look at that. Do you recognize that picture?
Yes, sir, I do.
Tell us what you see there.
Okay. It's another picture taken at the time of autopsy. And again, she's in supine position. This is not as close up as the other photos. And at the top of the picture is the case number that we put in the photos, and it's the unique identifier that we try to get in all the pictures. The photo itself shows her top of her head to the left side of the frame and her right shoulder at the extreme right lower corner. The number placard partially obscures her face, but in the center of the photo we can see her right ear and part of the right side of her head. We can see the area that I shaved off the hair so we could look at the injuries there. We also see a number of injuries to the right side of the neck. Also in this picture behind the right ear, I've placed a letter, an adhesive letter, that's part of how we keep track of the wounds.
What letter is on that?
It's letter L.
Okay. And what does that signify, the letter L in this case?
So far I've gotten to the letter L. So I start at A. I have a a sheet of these letters, and I just peel and stick them. It's just a peel and stick thing, and I will stick them on where the wounds are. And so
sequentially, if you went, I guess that's probably numerically, you went A, B, C, D, E, F, G, H, I, J, K, L.
L,
So
yes.
this is the L stab wound is what we're speaking about.
Yes, we're on L now. This particular photograph shows us the L that I put there. And all the wounds either got their own individual letter or the grouping of wounds got a letter, and then it was photographed. And that's so that if somebody wants to talk about these wounds, they can say, well, I'm talking about letter L. And then we can all look at the picture and know that this is the wound. Also, in this picture is a probe. Part of what I mentioned before about determining the depth of the wound is place a probe in the wound, and then that way we were able to tell the depth of this wound and its approximate path.
Can you show the jury on yourself? Can you point to the area on yourself where that probe was placed?
Yes, it's right kind of below and behind the ear, right here. I don't know if that's...
So the record could reflect that Dr. Beaver is pointing behind his left ear, kind of where the skull and the neckline meet. Is that correct? Yes. And did you measure that probe at some point?
Yes.
Okay, how deep was that wound?
I'd have to look at my report, but I believe it's about 4 centimeters.
Do you have the report with you?
Yes, sir, I do.
Would it help your recollection to take a look at that?
Yes, it would.
Please.
It probes to a depth of 3.6 centimeters.
Okay. Can you show us just kind of with your fingers about 3.6 centimeters is?
Yes, sir, I think it's about that far.
And what type of damage would a wound that goes 3.6 centimeters, excuse me, did you say centimeters?
Centimeters, yes, sir.
Centimeters into the area that you just showed, what type of effect could that have based on your medical experience?
Yes, it can go into the skull and into the brain, and that would be a serious wound.
Okay. Life-threatening?
Yes, sir.
Okay. Any additional things that you'd like to point out as it relates to states 346 at this point?
No, sir.
Okay. Now, if you'll take a look at, I believe that's stage 347 with the same instructions, just take a look at it and tell us verbally what you see.
Yes, sir. I'm looking now at 347.
Okay.
And this is a picture, again, taken at autopsy, very similar to the last one, showing the right side of her head and neck. Towards the top of this frame is her nose. Towards the left side is the top of her head. Towards the right side is her the base of her neck. And
You really disgust me. You are so low. You are a complete low life. I'm so glad that you are locked up for life. You'll never able to walk the streets again because you would have did this again. Low life. And make sure y'all look at the past videos if you missed it when he was up in the ATM machine trying to get her money. And it wasn't working. I guess that, when he was attacking her, he probably said, if you don't give me the number, I'll kill you, I'll kill you. And she knew he was going to kill her. And she didn't give it to him. Look at the low life. And then you should see the video too. Look past video when he was trying to go to the cellular phone place, trying to unlock the phone, trying to sell her iPhone. You low life piece of crap. Did this to this girl. All she was doing, ladies and gentlemen, just going out having a good time with her friends. That was just it. Just having a good time. College student. This is what we do in college. We go out, we have some fun, unwind with the friends. And then here he come driving up, just looking for a victim. And unfortunately, she got into his vehicle. She thought this was her Uber, but it wasn't. Instead, it was Satan Jr. driving. That's what it was, Satan Jr. All right, let's get back to it. He disgusts me. All right, resume.
What I'm doing in this photograph is I'm holding the ear forward so we can see behind the ear. There is a stab wound that actually goes through the ear and then ends up going into the skin behind the ear. And so to demonstrate that, I've pulled the skin forward. We can see the L that I said previously that designates this wound, actually another wound. The ones behind the ear are different. But That's what we're seeing here. And we also see the stab wounds to her neck.
Course indulgence. Your Honor, I'd like to have State's Exhibits 341, 342, 346, and 347 admitted into evidence.
They're marked for identification at this time.
And I'd like to have them entered into evidence at this time, Your Honor.
They're identification only at this time.
Yes, sir. And did you take these photos?
Yes, sir, I did.
Were they taken in the normal course of business?
Yes, sir.
No. Now let's look at, Mr. I'll give you, let's talk a little bit more after we talk about the neck and the head. Let's talk about the torso next. So I'm going to hand you just a series of pictures at this point in time, and I'll tell you exactly which ones these ones are. All right, I'm going to hand you
You published the photographs that are in evidence. The exhibit numbers are.
Thank you. The exhibit number, I'm going to show you, Your Honor, excuse me, Dr. Beaver, states number 343, states number 344, states number 349, states number 350, states number 351, states number 352, states number 353, states number 354, states number 355, states number 356, and states number 357.
They are in evidence.
I'd like to hand you these ones. All right, so let's start with the torso, if you will. We'll parse through those, take a look at those, and let's take the pictures of the torso out first. And let's talk about what you observed in the torso.
Okay.
All right. So which number do you have in front of you, sir?
So I'm going to start with states 356, I believe it is.
All right. Can the witness step down here? Yes. All right. You can sit down so we can talk it through. And you can bring that photo with you. Now looking at states 356. All right. Explain to the jury. Let's turn this way so you're facing the court reporter, and I'll hold it to it. Tell the jury what you're seeing here.
So this photo taken at the time of autopsy.
We'll have to rotate around. We may need to pause so each juror can see.
And the bottom is the placard. This is the placard I was talking about earlier, 270 sort of number. Then we're looking at her back, and now she's rolled up on her side. So, so we're looking at the left side, that's being her left arm at the top, and her right shoulder at the bottom. And we have cleaned her up. We have cleaned her up, so we washed off blood and things like that might have obscured the injuries. But we still see a lot of these, sort of the skin is sort of abraded off. And these yellow, sort of yellow, waxy looking things, that's all insect activity. So that's what ant, and this specific insects are ants in this case. So ants have taken and started to kind of take off the superficial layers of her skin. But there are also injuries here, and so we can see a stab wound here, a stab wound here, a stab wound here, and a stab wound here. So she has a number of stab wounds on what I would call the flank area. So in this area of her back. These ones, one of these goes actually into the lung, but then the other ones don't penetrate any internal organs. They go superficially, centimeter or two, but not into an internal organ. But the main thing is the insect activity is something to see there.
We're going to do this with each of the photos.
Okay. Would you like this?
Yes, sir. Yes, so yeah, take a look at the next torso photo that you'd like to take a look at.
I think, yes, I think this is, most of the rest are not torso, so I think this is the next one.
All right, well, tell us what we're looking at if you will show us, and tell us what exhibit you're looking at. Tell them what
So I am looking at 352, stage 352. And this is a photo. This time the body is laying on its back. It's supine. So she's laying on the table back. We've got the placard in here with her identifier, and we're looking at the abdomen here, and her hand is kind of resting up on the abdomen. So we can see here some of that insect activity again on her wrist. So the insects, the ants in this case, have done that. Then we can see the knuckles of her hand. She has a little defect right there on that knuckle, which it's indicative of some type of a blow, perhaps. And then she has a little bit of discoloration in the knuckles, contusion, maybe.
Yeah, we can set around this way.
Okay, so we have some swelling in the knuckles, maybe some discoloration, and we have this little defect here. And then the rest of her torso looks okay to me. And an indication of insect activity on her wrist.
If you could take the next photo in the order that you'd like to go through the slide.
Sure, I think we'll just start here. So this one is 343.
Okay, so stage 343. All right.
So here, we're looking at the arm. And so first, we have the insect activity I've been talking about. And we have two wounds, here and here. So superficial wounds where her arm came in contact with a knife or sharp instrument, cut there. And so this is the back of the left arm. So it'd be this area here. You can see her elbow here. And there's another injury here. So there's 1, 2, 3 injuries on that arm. And the yellow waxy material is post-mortem from ants.
And let's take a look at the next photo.
So now, stage 349.
Stage 349. Okay, explain to the jury what we're looking at here.
So this is the right shoulder and part of the right neck. So she's laying on her back, and the right shoulder is here in the center. Up to the far right corner of the frame is her right ear and some of the injuries on her right neck. But so what we have are multiple stab wounds in this small area. So in forensic pathology, we like to think of things that are close together in space, are close together in time. So these injuries would be from rapidly inflicting stab wounds. Because they're all very close together, some of them are overlapping. And there's a couple in here that caught my attention almost immediately, and they're parallel. They're two parallel cuts. And we will see others like that. And that, to me, I said, that's unique. It's very difficult to put wounds exactly spaced apart and exactly parallel. And so it made me think that we were dealing with an odd weapon and that we would be able to identify this weapon. So, so this is the first real kind of clue I started thinking about. It's when I saw that right there.
Yes, sir.
And that made me start to think about the type of weapon being perhaps not just generic knife, but maybe now something unique. So she has other wounds in her neck here, but again, these are all grouped together, and I would group this as a single grouping of wounds because they're all in the same area, they're all about the same size, and they go into the musculature. They're not going to be fatal by in and of themselves with medical treatment. They're not going to be lethal.
Now, if you look again at stage exhibit number 349 that we've been referring to, are you able to see any defects to her ear there?
Yes, sir. So this one at the far right, you can see there's a defect in the ear here. That's a stab wound that actually goes through the ear and into the neck from behind the ear. And we were talking about a photo earlier where I tipped the ear forward, and that was to see what that actually went through the ear.
Which exhibit number is that?
349, Your Honor. Yes, sir. Yes, sir. The same process would What exhibit are we looking at?
Yes, sir. This one is 344.
All right, 344, I'll hold that.
So here we're looking at the body again laying on the back. This time we're looking at the left arm. So we have the left arm and hand here. And the placard's in here. The arm is running across the frame and towards the bottom of the frame. And we can see the insect activity here, but she also has 2 small wounds on the forearm, and there's some hemorrhage into the soft tissues of the arm. Again, the wound's not lethal, but it just shows the level of activity.
The next photo, please, sir.
Yes.
So this is, we're looking at states number 350, 350. That's it.
So this wound, this photo, excuse me, you can see the peel and stick thing that I was talking about earlier. And the placard is at the bottom. She's lying on her back on the table, and we're looking at the right arm here. You can see one of the wounds that was up on the right shoulder, or in the grouping of the right shoulder right here. It's not a good angle photographically, so you could just see the discoloration of the skin. And then you see 2 parallel wounds in the elbow. So that to me, that was starting to, again, I'm starting to think about, at the time of the autopsy, I'm thinking these 2 parallel wounds to be that close together and parallel like that is very unusual, and it's going to mean something. I just need to figure it out. And then you can see her torso here. I don't see much there. Her hand would be off the frame to the bottom.
Thank you, sir. Let's grab that next exhibit. What number is that?
This is number 357. 357. So this photo, we're looking at the foot, and it's the right foot, and she's laying on her back, and there are some stab wounds here. And here we see really well that 2 parallel stab wounds that I was talking about. And when I probe these wounds, they run exactly parallel as well. So it's not like the knife went this way or this way, they're parallel in every respect. And so that's unique. And here I got the sense that there might be 1 and then 2, but the knife can go very deep. So now I'm looking at this really being some type of a unique weapon. And
Oh, yes, sir. Yes, sir. Anything else you'd like to discuss?
there's hemorrhage. You can see some pinkish discoloration around the wound, and that is hemorrhage. So we know she's got a blood pressure at this point, and blood is being forced out into the skin around the wound once the blood vessels are cut.
Thank you, sir.
So now we're going to look at the right hand. So placard's at the top. She's laying on her back. We're looking at the right arm. To the far right of the frame is about to where her elbow starts, or and then to the right of the frame are the tips of her fingers. And we're looking at this wound on the palm of her hand. So this is 2 parallel stab wounds. Small, exactly parallel, and they probe all the way through the hand. And they go side by side all the way through the hand. So and there's hemorrhage around, so you know she has blood pressure at this point. So there's a couple things to take away from this. First of all, it's a defensive type injury. You're being attacked with a knife, you put your hand up to try to reflexively block that attack. And the knife goes through your hand. That's what happened here. And both of those wounds are parallel. They're the same kind of parallel, close together stab wounds that we saw on the foot and the shoulder. And here they're really, it's a really good demonstration. So I took another photograph closer up.
Would you get that one, please? Thank you. I would help if I hold both of those side by side.
Yes, sir.
So we're looking at states exhibit number 354 and 355.
So I took a closer picture of the palm of the hand, looking at the palm of the right hand again, towards the top would be her wrist, towards the bottom tips of her fingers, and these wounds are exactly 2 little cuts that are parallel to each other, and they're a set distance apart. They doesn't vary, and they go all the way through the hand. So this wound is what you would expect for someone trying to defend themselves from a stab, and the knife hits them. But in this case, the knife is unique because it's got these 2 blades. It would have to have 2 blades or 2 pieces to the blade that would be parallel. And so at this point, I knew we could find a knife, we could match it up with this wound, because there's just, and I actually went to Google and I looked at about 1,000 pictures of knives, and I couldn't find any knife that was like this, that had those kinds of parallel blades. So, the next one.
Yes, sir.
So, we're going to look at 353.
Yes, sir.
353. So 353 is the right hand again. This time we're looking at the back of the right hand. So remember I said that the wounds to the palm went all the way through and came out the back. And so now we're looking at where it comes out in the back. And again, there are 2 parallel wounds side by side. And so coming out like that, there would have to be 2 parallel blades. So we have the hemorrhage around it, so she has the blood pressure, and the wounds are exactly parallel, and they're that set distance apart. So that would take some kind of a unique instrument to do that.
And all those match photos?
I think I have one more.
Okay.
This is 351. So here is the left arm, and it shows us the insect activity. Sometimes based on the positioning of the body and what the insects have access to, can tell us something. So sometimes if a body is moved from one place to another, the insects get on the body at one place and do damage some skin, and then the body is moved to another place where the insects don't have access, that can help us to piece together what happened. So that's why this photo was taken. There aren't any real significant injuries here, just hand activity. So that's the left arm. So the pattern here is that all injuries are occurring on the right side of the body, right shoulder, right side of the face and neck, down this right hand, left arm relatively spare.
Can you offer an opinion as to what would happen for those major injuries to take place on the right side of one's body?
That would be the side exposed to the attack.
Could I see the jury box if you would, please? Now, sir, I'm going to show you what's been marked with stage exhibit number 294. Would you like to hear it?
Yes, sir. Here.
I'm sorry, stage exhibit number 295. I'm handing you now with stage exhibit number 295. You referenced multiple times. Well, tell us what you're seeing with that, the interest you as you look at this.
This knife has two blades, and they are relatively parallel. They are bent at the tip, and they're the size appropriate for the wounds that I saw. This is the weapon.
And as you look at this, based on your 29 years as a forensic pathologist, do you have an opinion of that weapon and the injuries that Samantha Josephson sustained?
Yes, the parallel cuts are made by this.
Now, did you see, may I have stage number 225 back, please? Did you see some singular stab wounds as well?
Yes, and many, in fact, the majority of the stab wounds were singular stab wounds.
Let me hand that to you.
So,
Please speak to the jury.
yes, sir. So once this is pulled apart, like this, now it's a single-bladed weapon. So That's one of the things that was confusing me at the autopsy was I thought there must be two weapons because there was the parallel blade ones and then there were the single ones. So I thought it's unusual to have two weapons. But now I think it's explained to my satisfaction that this is the knife in this conformation would make the parallel wounds that I saw. And then if it's in this conformation, it could then make the single stab wounds.
Thank you, sir. Now, as you perform this all the time, well, I'll direct that question. How much blood does a human body only contain?
It's about 4 or 5 liters.
4 or 5 liters?
Yes, sir.
And so in U.S. metrics and American metrics, what is that?
It's probably close to a gallon.
Okay. And so as you performed the autopsy on Ms. Josephson, how much blood was found in her body?
It was not a lot. I found 20 milliliters in the pleural cavity, right pleural cavity, and really we had difficulty obtaining the blood that we used for toxicology.
And so 20 milliliters is about how much, if you could, again in layman's terms, tell us what 20 milliliters looks like?
Maybe an eighth of a cup.
Okay. So about this much?
Yes, yeah, a couple tablespoons, maybe 3.
So based on the...
Ladies and gentlemen, did you hear that? She lost that much blood. And her family have to hear this. Oh my gosh. Okay, resume.
Wounds that you saw and the fact that about 5 liters of blood should be in a human body,
Yes,
where
sir.
would you expect the blood to be found in this type of activity, in this type of case?
She's going to bleed out.
She's going to bleed out, you said?
Yes, sir.
Okay.
And one of the neck wounds involves the carotid artery and the jugular vein. We haven't talked about it much, but that wound would produce a lot of blood flow.
Okay. And you'd expect to find that blood where?
Wherever it took place, wherever these wounds were inflicted, the blood would come out immediately, just like the hose analogy.
All right. Now, you mentioned the neck wounds and the jugular vein. Is there something called a hyoid bone?
Yes, sir.
Okay, let's talk to the degree about the hyoid bone and what you observed with that.
Yes, sir. For forensic pathologists, the hyoid bone has a great significance. It's a little horseshoe-shaped bone. Literally, it would fit inside my hand right here, and it sits up high in the neck.
And so if you'll just show us.
Sure.
Yeah,
It
just show
sits
us.
up high in the neck.
Yes, sir.
And it's hooked to the back of the tongue and to part of the larynx. And it's a free-floating bone. It doesn't articulate with anything. It's not like an elbow or something. It's hinged by muscle. So there's muscle of the tongue on one side of it, muscle on the throat on the other side of it. So, and for us, it's the sine qua non, and that which names, of manual strangulation. So if you strangle somebody, you put your hands on their neck and you squeeze, that will fracture the hyoid bone. So when we see a fractured hyoid bone, it is manual strangulation until proven otherwise. The bone, because it sits so high up in the neck, it's very punches and blows to the neck don't affect it. Because it's mobile and it's attached to muscle, again, blows to the neck generally don't affect it. You have to get that squeezing motion to fracture it. So she had a defect in her hyoid bone on the right side. In her case, though, I'm not of the opinion that it's a strangulation. I think it came from one of the stab wounds to her neck. The knife actually got up high enough to sever the hyoid bone.
So it's your suggestion that states exhibit number 295, this knife would have gotten high enough to sever that bone?
Yes, sir. And so it doesn't say for us that, for me, it doesn't say absolutely. I couldn't tell you absolutely there was no manual strangulation involved, but I can tell you I would favor that it was done by a knife, by the stab wound. But it would be high to do because that bone is relatively protected. Even in ligature, when we see a ligature strangulation or someone committing suicide with a ligature,
What is a ligature? I'm sorry. Explain what a ligature is.
Oh, so if we put a rope around the neck, very common way people commit suicide, common way for people to attack each other. And even then, you don't see fractured hyoid bone because the ligature, the rope, the wire, or the foam cord slips up over the bone or slips up underneath the bone, but it doesn't get the hyoid bone. So hyoid bone for a forensic pathologist is manual strangulation until proven otherwise.
And so here you said there's a severed jugular?
Yes, and carotid artery as well.
All right. And so based on your 29 years as a forensic pathologist, are those wounds lethal wounds?
Yes, sir.
Okay. And so when we talk about the types of lethal wounds that you saw, we talked about an injury to the brain,
Yes, sir.
and we talked about the injuries to the hyoid bone
Yes, sir.
and the jugular. Any or both of those could be considered lethal wounds?
Yes.
Okay. And the wounds that you saw consistent with stage number 295, the knife you talked about, do you have an opinion right now that you can tell this jury of what caused Samantha Josephson's death?
Yes. Multiple stab wounds. I made the cause of death multiple stab wounds.
Court's ability trial.
Gentlemen, we're going to have you go to the jury room for
Multiple stab wounds. Okay, we're gonna the guy's gonna still be on the stand, but now we're gonna hear what the defense when they cross-examine him. But I'm gonna put that a little bit faster. Hold it just a second. Let me skip to the defense. Let me play a little music while y'all wait for a second. Just takes me a quick second to put it on. Alrighty.
Okay, thank you. Almost seated.
Okay, this is the defense. They're gonna
All
cross-examine.
right, welcome back. You may continue.
Thank you, Your Honor. Now I'm going to show you Dr. Beaver State Exhibits number 347 and State Exhibit number 341. You take a look at those, please. We discussed them briefly, but I want you to take a look at those.
You need to choke over that water. You need to choke. Okay, let me turn down the music. All right, I think I'm gonna pick this speed up here. Well, let me just see what's happening right now real quick. All right, let it resume.
Yes, sir.
Are those familiar to you?
Yes, sir.
And those, again, are pictures from the autopsy that were taken that you performed?
Yes, sir.
All right, I'd like to have those two exhibits entered into evidence, Your Honor. Thank you. Can the witness step down, please? Now, Dr. Beaver, first I'm going to show you what's been marked. It states exhibit number 341. As we talked about your testimony earlier, when you explained to the jury the significance of this photograph and what that helped you ascertain?
So the first thing that I didn't mention before, but it's a good
Come
thing.
on, please.
So I didn't mention this before, but it's a good thing this reminds me. Insect larvae are here.
I apologize. It's still, the prosecution is still questioning him. So we didn't get to the defense questioning him. All right, resume.
So that's what those are. And so flies will come to the body almost immediately within a matter of minutes. They lay their eggs and the eggs hatch. And that's what you're seeing there. It takes a few hours for the eggs to hatch. So these are the marks on the side of her face that I was talking about earlier. They're parallel, and remember they're yellow and kind of waxy looking, so they're post-mortem. There's no blood pressure to cause these to hemorrhage. They're occurring in the post-mortem interval. And because of their parallel like this, pretty much all running the same direction, that makes me think that there's a surface there that's now scraping across your skin. So to me, this means that the body has been moved in the post-mortem interval. Somebody's moved the body after death. And it also tells me a little bit about the insect activity too.
Thank you, sir. Now, next I'm going to show you what's been marked as State's Exhibit number 347.
So,
Explain to the jury what that is and the significance of that photograph, please.
so we talked about the photograph with the letter L in it before, and it's showing the right side of her head and right side of her neck. And here I talked about the stab wounds to the ear on the other side, and here I folded up the ear so we can see behind it. And you can see again the two parallel lines of where the stab went through the ear and then went into the neck. This is not a fatal wound. These two parallel wounds are not fatal, but they're of interest because it's helping us to identify the weapon. You can see some of the insect larvae are in her hair, And then there are some wounds here. This wound here goes into the skull and the brain, as does this one. Also, this wound here is somewhat unusual in that it has what we call a dog leg. Dog leg just means like an angle. And what it means is that the knife, either the knife or the body, they have turned relative with the blade in place. So if you stab this person and then you twist the knife, or they move their head, you create this dog leg type of situation. So I know that and here I believe that the blade hit the skull and then was deflected, and that's what created this dog leg. Skull is very dense bone, has 2 tables, so there's like 2 layers of bone, and this would be a place where that would happen. The wounds on her neck, you can see them here. What's interesting of these wounds is that you can see that how they're kind of squared off at the back. This is a straight line, and it's sort of a V at this edge. So here, squared off V. These 2 don't show it as well, but that helps me to tell this is a single-edged knife, so it's not a double-edged weapon, and that the heel of the knife, the flat part of the top, is here, and the cutting edge is there. So it orients the knife relative to the body.
So Dr. Beaver, as I hand to you again, State's Exhibit number 225, I'm going to give you these gloves if you like. Holding State's Exhibit number 225, that to you. That weapon, as you compare it to the actual sharp force injuries that Ms. Josephson sustained, tell us what your opinion is.
So this knife has the 2 parallel blades, and it would be stabbed like this. So, this knife fits. These are single stab wounds, so the knife would have to be like this for these. And it has a flat part here, so the flat part would be like this. This one has a flat part too. This has a more serrated edge to it, and that leaves distinctive markings on the edge of the wound sometimes. I don't want to get into it, but I think this might be where this part of the saw blade was used. But it's too hard to say for sure.
Thank you, sir. Turn the witness hand to you, please. Now, I'm going to show you what's, we talked about this briefly. State's Exhibit number 352. May I hand that back to you, sir? Just reorient yourself to that picture, if you would, please.
Yes, sir.
All right. Now, in your 29 years as a pathologist, again, some 10,000 or so autopsies that you've done, do you always find DNA under fingernails?
No, sir.
Let's talk about that just a little bit with State's Exhibit that I just handed you. What is it that you do during an autopsy when you photograph fingernails?
So during the autopsy, we use the autopsy as a means to collect evidence. So we clip the fingernails and place those into an envelope, and then that is turned over to law enforcement for analysis. So we take each fingernail and we have a clipper and we clip them, and then we put the clipper in with the fingernails. So they've got the clipper as well as the fingernails. In my experience, the DNA is hit and miss. Sometimes you get it, sometimes you don't. And there are so many places in which the specimen can be compromised. The first is that the person doesn't have any DNA under their fingernails. They didn't scratch anything, they didn't get that material.
I think that's good with his expertise.
Response.
Your Honor, he's a forensic pathologist. He's been doing this 29 years. He's examined over 10,000 bodies, and he's got an opinion as to why DNA wouldn't, if a person is doesn't have DNA under their fingernails, he's giving a reason why that would not happen based on his experience.
He hasn't been qualified in that area. He has to sustain the objection.
Thank you. So you talked about reasons here or there. You clip fingernails, you turn them over to law enforcement.
Yes, sir.
Okay, and once you've done those things, at that point in time, after you photograph the fingernails, do you do anything particular after that? Did you observe anything particular of her hands that were of interest to you and her nails?
She had injuries to her hands. Also, I don't think her nails were very long. As I recall, they weren't long. They were fairly short. So I don't know if that affects the recovery of DNA.
And so as we wrap up, you gave an opinion as to the cause of death here?
Yes, sir.
Okay. The cause of,
Multiple stab wounds.
okay. And the blade that actually inflicted those stab wounds was what?
It's the tool you showed me with the parallel knife blades.
States Exhibit number 295?
Yes, sir.
Thank you. That's all my questions at this time.
Cross-examination.
Thank you very much, Your Honor. May it please the court.
Yes.
Good morning.
Good morning.
And you have a copy of your report with you today, right?
Yes.
Okay. And the date that you examined Ms. Josephson, that was March 31st, is that right?
Yes, ma'am.
Okay. And during that exam, you're wearing protective gear,
Yes, ma'am.
right? Gloves, is that right?
Yes, gloves. Yes.
Wearing protective gear on your hair, on your head?
Yes,
to cover
ma'am.
your hair?
Yes, ma'am.
And probably on your body, right?
Yes.
Okay, this is the defense cross-examining. I'm going to speed this up. Yes, we are. Because, we're just going to speed up with the defense. Yep. So now I'm going to speed up to 1.5, ladies and gentlemen. Now, if it's too fast for you, you know what to do. Just slow it down on your end. All right? And make sure the people that's coming in or watching the replay, please make sure you hit the like. Share your thoughts and opinions in the comment section. And like I said, if you need to reach out to me, you can find my email in the description. If you have any viewers requests or if you need of coaching, anything like that, you can find my email in the description and also in the about page, ladies and gentlemen. But don't forget, hit the like and share the video out to your social media and check out some of my past commentary. Resume. Let's get it. Let's see what the defense has to say. Like I said, it's on speed 1.5. If it's too fast for you, you can slow it down to on your end. Let's get it.
Yeah, we wear a plastic gown that goes over the head, has sleeves, actually goes over your thumb. Then I personally wear 2 pairs of gloves, and I have a hat, and then I have a mask. And it's a paper mask similar to the ones that are here like this. And then I have booties on. And then under all that, I'm wearing scrubs, clothing that stays in my office that doesn't go anywhere else. And MUSC has a service, a machine. I turn the scrubs in and I get new scrubs every time.
Gotcha. And anyone else that would be present with you in that exam room, they would have protective gear on as well? At least gloves.
Yeah, for our technical staff, they all would, including the person that takes the x-rays. Sometimes law enforcement comes in and they don't.
You told us earlier that your exam starts by doing an external kind of view of Miss Josephson's body, right?
Yes, ma'am.
You take her weight,
Yes, ma'am.
right? You indicate that she was 160 pounds at the time of autopsy.
Yes, ma'am.
She was 69 inches tall.
Yeah, yes, ma'am. They're laying down.
Long, I should say.
Yes, that's-
69 inches long, and that is 5 feet 9 inches.
Yes,
Is that
ma'am.
correct? Otherwise, a healthy adult female.
Yes.
Okay. And you also, during your kind of external exam, you take note of the clothing that she has on,
Yes, ma'am.
and any notes about that you put in your report. Anything you observe.
Yes, my exam of the clothing is more superficial of the kind of clothing she has on, and general description. I don't go into detail examining the clothes because I'm going to take them off and I'm going to package them and they're going to be sent to an evidence technician who's going to examine them thoroughly.
Because your job is related to examining the body.
But exactly.
In this case, it came with clothing on it.
Yes, ma'am.
On her. And you did mention in your report that you noticed defects in the clothing,
Yes, ma'am.
specifically her shirt,
Yes.
and that it was heavily bloodstained.
Yes.
You go on to make notes about her fingernails.
Yes.
And in your report, you indicated that they were medium length at the time.
Okay.
Today, you're telling us that you thought they were fairly short in length.
Well, they're not long, let's put it that way. So I was in the idea of getting DNA under your fingernails. Long fingernails are will be more effective in getting some kind of DNA under your fingernails than short ones. So hers are medium length, so probably a little bit longer than mine, but.
But you noticed that they were medium length.
Right.
And they would be, show you my nails, longer than my nails.
I think yours are about medium length, maybe.
This is medium length.
Yeah, so if you can see, on short is no white, okay? No white
Yeah,
color.
I have no white on my nails.
Hard to see your nails, but
But you were able to notice with the nails that she had evidence of tearing. That's what you put in your report.
correct, yes,
And at the autopsy on March 31st, you take the clippings.
correct,
And along with the fingernail clippers that you clipped with, put those in a bag, right?
Correct.
An evidence bag.
correct,
And those get sent off.
yes,
Law enforcement takes those, right?
Yes.
Takes those back to the lab, right?
yes.
And you go on to tell us about you notice that there are offensive wounds on her knuckles. Is that right?
I'm not sure what you mean by offensive wounds.
I believe you told us, as it relates to picture 352, states 352. Yeah, there. Is that 352 that you noticed on her knuckles.
Yes, so the discoloration is on this part of the knuckle. Well, do you want me to talk about this or not? Is there a question?
The question was, you noticed a defect with her knuckles,
Yes,
and that is on her I believe that her right hand, left hand, which hand is that?
it's the left hand.
And you told us on direct that was indicative of a blow.
I said that it could be blows or struck.
Okay, like she hit something.
Yes,
Okay. And on the flip, there was a stab wound to the other hand,
correct.
and we call that a defensive wound.
Yes,
Something that you would see if somebody put up their hand to stop something from happening.
yes,
And that went through and through.
yes,
You also told us that Ms. Josephson experienced significant blood loss,
yes, I believe so.
that it was difficult to even obtain a sample to send off for toxicology.
Yes,
And the deepest, and I'm just looking at your report here, and correct me if I'm wrong, the deepest wound we noted here was 7 centimeters, I believe,
yes,
and that was to her thigh. Is that right?
yes.
And 7 centimeters is what?
3 inches or so.
Less than 3 inches to, I think it's 2 3/4 maybe.
Okay,
And that's the deepest wound. I'm not gonna touch it. We've seen it plenty, but the weapon that we talked about here today, it opens up, you said. Is that right?
yes, I had not seen the weapon before it was presented to me today, so I did not know that it opened up until I saw it this morning.
But you've
And-
been told, you had a conversation with the prosecutors in preparation for trial where the discussion about this multi-tool was had, right?
Yes, that was like a few days ago.
And during that conversation, you would say that some of the wounds are consistent with being made by the multi-tool in the open position and some in the closed position.
Correct.
So there was some information you had prior to today about what type of weapon was alleged to have been used.
Yes,
Okay. And then also at that time you told them there was evidence of offensive wounds because of the discoloration and defects you noticed on her knuckles.
I'm having trouble with this offensive wound thing.
And I'm just using the words that we were given that you would be testifying to.
Okay, so do you want to hear what my problem is or not?
Sure, yes, sir, please.
Okay, so the knuckles that are in question are the ones that show defect, are these here, like this one,
Okay.
and this one, and this one, okay? So offensively, when you make a fist, mostly you hit these knuckles, not ones that are in, and not necessarily these. So I don't know exactly how those knuckles were injured. They could have been injured in throwing blows, but I'm not going to say that they are offensive injuries.
Okay.
It's a fine gradation of logic, but
I
that's
understand.
what I mean.
But based on that photograph and your observation, it appeared that she hit something.
Yeah, she hit something or something hit her.
Gotcha. And you described these wounds, and there are a lot of them. I believe you said there were over 120 or around 120.
Yeah, something like that.
And multiple stab wounds in a small area. That indicates to you close in time, or close together in space, close together in time.
Correct,
This is a these are rapid stab wounds.
in my opinion.
Yeah, based on what you observed on the right-hand side of her shoulder, right?
Yes,
That grouping of wounds there, right?
yes,
Okay. And again, we have wounds all over her body, right? In all areas of her body, not covered completely, but they're not just on her head, not just on her torso, but she had some on her legs, her foot, her
Correct.
back, right?
Yes, she has wounds in many places.
You were able to see those as you examined externally. You were able to see those and make notes
Yes, ma'am, and photograph that.
and photograph. And did you do any measurements, or I guess you did mention that you had done a Google search to see if you could find anything, but did you, other than, did you measure the alleged weapon in this case?
I never even knew this weapon existed until a few days ago.
Okay. So it has 2 different blades, right?
Yes,
And then when it opens up, the blade would be, there'd be a blade on each end, is that right?
yes.
Okay.
And I didn't know any of that until just a few days ago.
And
Defense is grasping for straws.
you didn't get a picture of the weapon at that time?
No, and in fact, I sent law enforcement a picture that I thought might be the weapon just from my search of thousands and thousands of images of knives, and but it turned out to be something entirely different.
Interesting. Back to court's indulgence. Do you remember who you sent that picture to?
No, ma'am, I don't. This was a long time ago.
Right.
I sent it literally within maybe 3 days of the autopsy, and then I haven't visited this autopsy since, until we had the discussions a few days ago.
Would that have been a South Carolina law enforcement division investigator?
It was
or
somebody who came to the autopsy.
somebody who came to the autopsy. Okay. No further questions. Thank you so much.
We direct.
Thank you, Your Honor. And Dr. Beaver, you said that
First of all, please have a seat, say your full name correct.
I skipped it a little bit.
Justin Andrew Martin.
Mr. Martin, please tell this jury where you're employed.
I work for the Fifth Circuit Solicitor's Office in South Carolina.
How long have you worked for the solicitor's office?
Okay, this is the prosecution questioning this man right here. Resume.
Approximately 4.5 years.
All right, and what is your position there?
I'm a body cam and video analyst.
Body cam and video analyst, what does that mean?
I collect and distribute body camera evidence from multiple law enforcement agencies within the district, distribute that evidence to the appropriate staff in our office, and I also help with compatibility and codec issues with surveillance video from various private and public entities. I provide redaction services for trials, and I also create demonstrations of video and audio evidence for trials.
And you referenced surveillance footage. Does that include the likes of statewide security?
It does.
That's a business that Mr. Shealy, who was here earlier this week, is that correct?
Yes, sir.
All right. And as part of your duties, you review surveillance footage such as this?
Yes, sir.
In some instances, does that include the editing of some of those videos?
Yes, it does.
And how so?
I will take evidence that we often receive a tremendous amount of volume of video. Oftentimes we'll receive video that has nothing to do with the trials. Law enforcement gives us cameras that aren't necessarily on the scene of a crime. Sometimes the video files can be extremely lengthy, ranging from 10 minutes to several hours long, when the action that pertains to the case really only consumes maybe a minute or less of that camera footage.
All right, and we can show you State's Exhibit number 3 and State's Exhibit number 12. They're both already in evidence. You recognize those?
I do.
And State's 3 is what?
That is video from the Bird Dog business.
And State's number 12?
That is security footage from statewide security that is owned by Mr. Shealy, I believe.
All right. And approximately how much content is on the statewide security videos in State's number 12?
I believe there's about 28 gigabytes of video, and that roughs out, because of the system that they use or the different cameras that they use, it roughs out to be around 25 hours of video,
So if you were to watch every video on State's 12 all the way through, it would take approximately 25 hours, is that what you're saying?
give or take.
All right. And additionally, the videos on State's 12, you've had an opportunity to review those, correct?
That's correct.
As provided, were they in any sort of sequential time or location order?
They were labeled by an approximate area of the camera's locations. They were not organized by time or by position, only by chapter, which is could mean a different camera location or a different time frame in which that camera was recording.
When you say that they were labeled in some way, what identifying features were they labeled by? Not the chapters, but the cameras themselves.
They might have the location of the corner, an intersection that the camera footage was recorded at. And that's the most of it. Either it's that, and then at the lower level, it's a chapter number.
All right. And did you have an opportunity to create a PowerPoint in order to try and streamline the information contained in those 20-some hours of video?
I did.
And that's as a result of Stage 12 and Stage 3?
Yes, sir.
Okay. During the creation of this PowerPoint, what was the focus of what you were looking for in those videos?
A Black Chevy Impala.
Okay. And specifically as it pertains to the Impala, were you looking for times and locations of the Impala?
That is correct.
On March the 29th, 2019?
Yes, sir.
Okay. Were you able to, in fact, find clips of what appeared to be a Black Chevy Impala?
Yes, I did.
Did you pull those clips and put them as part of your PowerPoint?
I did.
And those were pulled from the originals provided by Statewide?
Yes, sir.
Mr. Martin, when you do that, do you alter those clips in any way?
I do.
How do you do that?
I reduce the amount of time on the clip. I start a video clip at the beginning of when the action of the Chevy Impala is on camera, and then I generally cut when the action of the Impala is no longer on camera.
Okay. And are there additional features that you might insert into the videos in any way regarding those clips?
Yes, I will sometimes duplicate the video layer and create a highlight on the actionable part of the Impala, especially in areas of the video where there's a lot of other action occurring on scene.
So you would highlight the activity of, in this instance, an Impala, right?
Yes.
Is that what you're saying?
Yes.
And then also in various cameras, would you also then zoom in as well?
Yes, the technical term would be to scale and translate, but really I'm just stretching the pixels out so that it fills more of the actual screen space on the display, and then I reposition the video layer so that the area that the Impala is on screen fills the screen more fully.
Even with the edits, as we'll call them, that you've just described, do the clips included in your PowerPoint, are they a fair and accurate representation of how the originals appeared?
Yes, sir.
Okay. And do you also use maps in this presentation?
I do.
What are those maps of generally?
I made several maps with images with little triangles on them that indicate the view angle of the various cameras that the video was captured from.
And what was the purpose of that?
The cameras throughout Columbia and the Five Points District are numerous. There's several of them. They are oriented in different positions and different directions on different streets. The purpose of it is to show what angle you are seeing what footage from.
The maps that you refer to, do those also provide a fair and accurate depiction of the locations that you're describing?
Yes, sir.
And would use of this PowerPoint assist you in showing what's believed to be locations and times of what appears to be a Black Chevy Impala?
It would.
I'm going to show you. So mark the stage 358 for ID. What is that?
That is a DVD presentation I put together and burnt onto a disc.
And is that a DVD of the presentation that we've been discussing here in the last few moments?
It is.
And the contents of this are the same as what you have been discussing?
It is the same content.
All right, this time we offer stage 358 in general.
No objection, Your Honor.
Submitted without objection.
All right, thank you, Your Honor. May the witness step down? Thank you. Your Honor, permission to publish. Thank you. Mr. Martin, I'm going to ask you to try to keep your voice up while you're down here so the court reporter can take down what you're saying.
Yes, sir.
All right, if you would give the jury some sort of orientation as to what this map from stage 358 is.
This is the Five Points District where the incident occurred. This is Divine Street heading east. Down, and as it merges here, it turns into Garners Ferry Road, which is also 378.
Is that also known as Sumter Highway?
Yes, sir.
Okay, and you earlier referenced on these maps that there were some triangle shapes of some kind. Can you tell us what those are on this map?
Each one of these triangles represents a different camera on the same pod from Sheely or statewide security. So oftentimes these pods will have 3 or 4 cameras on each device. One is facing due west, one is facing north, or due east, one's facing northeast, and one's facing north. And this is at the intersection of Divine Street and Fort Jackson Boulevard.
East of Five Points?
Yes, sir.
Okay. All right, and do you have those clips from those cameras?
I do. And they're in the following slides. The first video is from this position. The second video is from this position. The third video is from this position.
All right. So this is looking which direction on Divine/Garners Ferry Road?
This is looking east on Divine Street before it turns into Garners Ferry Road in front of the Bilo across the street from the intersection of Fort Jackson Boulevard and Divine Street.
So Sumter is that way and Columbia is back towards me?
Sumter is heading away from the camera. 5 Points is toward the camera. And we see here
What appears to be,
what appears to be a Black Chevy Impala.
okay, and that's again heading towards Columbia.
That is headed toward 5 Points at approximately 1:48 a.m. on March 29th.
When you say approximately, why do you say that? You can let it play while you answer my question.
boxes that house the various cameras, each location can have variations in the timing or the clock that burns this time into the video image. They can vary various amounts from each location because of possible power outages or other technical issues that might occur at that specific location.
All right. What's the next one, please?
This is from the same location, but the camera is pointed slightly more to the northeast. You see the same vehicle here moving forward. 5 points. And again, same location, looking more northward on Divine Street, heading toward 5 points at 1:48:23 a.m.
Okay. And if you could orient the jury to this map.
So from the previous location, the previous camera angles that we looked at would be over here, approximately 2 miles further east from the current triangle, which is on the intersection of Divine Street and Holly Street. This camera is facing due east.
And 5 points is where in this?
On the left side of the screen, approximately 6 blocks from this camera angle.
Okay.
Again, the time on this one appears to be approximately 1.5 minutes fast. You see the chevron and the same body style as the Chevy Impala.
All right. And this map next shows what?
So this is further down Divine Street.
Same street that
The previous video indicated.
Okay.
This is further west on Divine Street at the intersection of Divine and Hardin Street. These are 2 cameras located outside of Lucky's bar. The first slide that we'll see is from the north-facing camera facing Divine Street, and the second video is facing northeast directly into the intersection of Divine and Hardin Street.
So the street that we're looking at here is which street?
It's Divine Street.
Fine. Is this an example of one of those highlights that you were referencing?
Yes, sir. Car comes to a stop behind a champagne-colored car. Take note of the rims on this vehicle. They are 5-spoke rims with splits in them. The car has some identifiable markers, such as those rims. Has a shark fin antenna. The taillights grade down on the top horizontal lines toward the center of the trunk. It waits there, continues forward toward the intersection. This camera is located panned slightly more to the right, as we saw on the previous map. You can see the champagne-colored car here as it waits to go through the intersection, and the Chevy Impala here waiting behind. It waits here for several minutes as the...
Now, I'm sorry. You referenced the car in front of what appears to be the Impala as a champagne-colored car. Why do you reference other vehicles or other pedestrians, things like that, in these videos that you're describing?
When you get into a busy area like this, you start to have an easier time locating specific instances or certain vehicles because of continuity. Certain cars are moving across the intersection before this car passes into the intersection. You can identify that the cars are the same or the pedestrians are performing similar actions in similar corners. That way you can tell that even if the time does not match up on the camera, but you're still seeing the same period of time because the action is the same, you're just seeing it from a different angle.
All right. Where does the black car go from here?
It waits here until the light indicator turns green, and it continues west on Divine Street past Hardin Street.
Where, if you could, in this camera angle, approximately where is the Bird Dog bar located?
You could see, it is hard to see from here.
They're kind of obstructed by that sign there.
It is. There's a parking lot here. The Bird Dog and Natural Vibrations would be obstructed directly behind this 5 points banner on this utility pole.
All right. All right, so we're going to talk a lot about this area, this 5 points area. Can you give the jury kind of an overview of some of the key streets in the area and how they all interact with one another?
Absolutely. Divine Street is the street we've been watching the Impala drive in on. It has a little hook that turns down here towards Saluda Avenue. This is Blossom Street. This is Hardin Street, which goes north all the way to Richland Hospital. This is Green Street. This is the 5 Points Fountain. Natural Vibrations and the Bird Dog restaurant are right here
On Hardin Street?
on Hardin Street. And this is a parking lot that goes from Hardin Street into Saluda Avenue. This is yesterday's restaurant. We don't have it on here, but there is a bar called the Cotton Gin right here, which we also have some video from.
And so the next cameras are going to depict from the area of what was yesterday's restaurant, is that right?
Yes, sir. It faces northeast, the first camera, and the other camera faces due west. Again, you can see the Black Chevy Impala waiting at the red light. When the light turns green and continues west, you'll see a white truck pass it headed east. And then the next, again, to show continuity, you see the white truck approach the stoplight. It will sit here for a moment. You can see the highlighted area here as the Black Impala continues west towards Saluda Avenue. It comes to a stop at a stoplight there. It's also followed by a black car that pulls into the right lane beside it. Comes to a stop at the intersection of Divine and Saluda Avenue.
All right, and what is the next?
And there's a large passenger bus that follows alongside. I mentioned these things to show continuity. The next camera angle is facing southwest, looking down Saluda Avenue from the intersection of Divine Street and Saluda Avenue. It shows the median here and this intersection at Blossom and Saluda Avenue.
And can you describe the setup of Saluda Avenue here? You mentioned the median.
Yes, there's a very large, wide median that separates the northbound lane and the southbound lane on Saluda Avenue. As it approaches the fountain at 5 points, there is a break in the median at the intersection of Divine and Saluda, and there is a break in the median at the intersection of Blossom and Saluda.
And then the median, does it extend across Blossom Street into the neighborhood here?
Yes, the raised median continues into the neighborhood, and there's a north and a southbound lane for Saluda Avenue, moving south from that location as well.
So this is looking towards that neighborhood, is that right?
Yes, sir. And there's the black car that was to the right, Black Chevy Impala turning into the left turn lane, and the large passenger bus continuing on to Blossom Street.
And the approximate time, I understand your caveat about not being able to say the exact time, the approximate time at this point is what?
Approximately 1:57 a.m., March 29th. We sit here for a little bit of time waiting for the light to change, but the Impala performs a U-turn and comes back north on the northbound lane on Saluda Avenue, gets into the right turn lane on Divine Street to head back east.
And just to make sure we're oriented, so is that turning right here, is that headed back where it just came from on Divine Street?
That is accurate.
Okay.
This is a previous camera angle that we just looked at as we watched the Impala move towards Saluda Avenue. We're going to use the same camera to show the action of the Impala moving back toward the intersection of Hardin and Divine Street. And in addition, there's another camera angle on the side of the same building from the same group of cameras that faces directly across the street of Divine Street. And again, this one has been highlighted. This right turn indicator is on as it approaches the intersection. This is turned slightly to the right near the same location. Right turn indicator is on. You can see the rims match. And it turns right back south onto Hardin Street. These two cameras are near the Cotton Gin Bar.
And we, just for a refresher, we were right here just now, is that right, the corner of Divine and
That is
Hardin?
accurate. The car traveled from Divine Street down Saluda, stopped here, performed a U-turn, came to a stop at this intersection, turned right back on Divine, and now it's turned right back on South Hardin.
Okay.
It's been highlighted, you can see as it pulls past the yesterday's building, turns right onto Hardin Street, headed south. This is panned slightly to the left. Same car approaches Blossom Street and Hardin Street, turns on its left indicator, and circles back around again, heading north again on Hardin Street.
Back towards Divine, is that right?
That's accurate.
Okay. Next one, please.
From here, the car continues on past. It sits here as it waits for some other traffic to move forward. And this is the previous camera we just viewed. The Black Chevy Impala will appear on the left side of the screen. We'll continue northward on Hardin Street. We'll change into the right-hand lane. It's avoiding pedestrians. It comes to a stop at the traffic light at Divine and Hardin Street.
What direction does it travel from there?
It continues north on Hardin Street. The next two camera angles we look at are outside of the Bird Dog restaurant. The first one is facing due east. The second camera is facing northeast.
And so what you've described thus far, correct me if I'm wrong, is then down in this area, and then just now we witnessed here on the Hardin Street block between Divine and Blossom, is that right?
Right. It continued here and circled back around here and headed back north, and is currently sitting at the intersection of Divine and Hardin Street.
Okay. So this is looking back which direction?
This is looking southeast. So the car as it passes. And it's north on Hardin Street. This is a camera angle slightly turned left as it continues north on Hardin Street. And you'll see a gray truck here.
And approximately what time is this?
This is approximately 1:59.
Where is this camera in relation to the Bird Dog bar?
It is slightly to the, if you were to stand and look at the Bird Dog restaurant, it would be to the right. But it's more in front of the Natural Vibrations business, which is next door.
So from this angle, though, the Bird Dog would be to the right?
Yes, sir.
Okay.
So moving further up Hardin Street, the previous camera angle we just viewed from was right here near this parking lot of the Bird Dog. Impala continues northward on Hardin Street. It passes Green Street, and at the intersection of College Street and Hardin Street, the next several slides are from these three camera angles. we started this angle, 2 videos on that angle, and this angle, and that.
And is there a particular point of interest there as a reference point in this area?
There's a Chick-fil-A that's very popular. I think 5 points right here.
All right.
There's some more raised medians.
Lowlife, what are you over there writing? What is it? The proof is right there. The cameras is all over the place. You was driving around looking for a victim. It has everything. What is you could possibly writing to your lawyer that's going to change anything? Man. Wow. All right, resume.
Chick-fil-A that's very popular. I think 5 points right here.
All right.
There's some more raised medians.
So where would the Chick-fil-A be in regard to this camera box?
Approximately where you're standing, but further back another 100 feet. You see we got the gray truck following with continuity. This is another angle facing more northward. You can see a Black Impala turning on its turn signal, performing a third U-turn as it turns around and moves south on Hardin Street, headed back into the 5 Points District.
Back towards Divine?
Yes, sir.
Back towards Bird Dog?
Yes, sir. And this is just a zoomed version with a highlight to show. There's the gray truck, the hatchback is behind there. The Impala performs a U-turn and continues south on Hardin Street. This is turned right again slightly. You can see the same car continuing south and pointed even more south this angle from the same camera box. Yes, sir.
Looking back towards?
Back toward 5 Points, yes. And then again, for continuity, we'll see a white car following it now as it heads back toward Green Street. The next camera is south of the previous camera, looking north outside of Breakers Bar at the intersection of Hardin Street and Green Street. See the Black Chevy Impala continuing south on Hardin Street, and the white car is still behind it. This camera is located outside of Natural Vibrations. It's facing northwest.
And that is where in relation to Bird Dog?
It is directly next door to the Bird Dog restaurant. It faces northward. You can see Hardin Street, a little bit of this parking lot from this angle.
The approximate time on this camera?
1:59, 2 o'clock a.m.
And what does the Black Impala appear to be doing here?
It's turning into the parking lot beside Natural Vibrations. And it appears that it pulls all the way through the parking lot to exit on the back end of the parking lot.
You can go enter and exit either side of that parking lot, is that right?
From Hardin Street or Saluda Street, or Saluda Avenue, excuse me. This camera angle is located on the camera box at Green Street and Hardin Street. It faces south. It's near to the 5 Points Fountain. The camera angle shows at a distance the parking lot that the Black Impala just pulled into and down Saluda Avenue.
It shows that parking lot from the opposite side of what we were just looking at, is that right?
It shows it, yes. From the previous camera angle, it is the opposite angle.
So where's Saluda Avenue and where's Hardin Street here?
Hardin Street would be on the left side of the frame. You can see the Black Impala pulling through. In the center of this camera angle is the northbound lane of Saluda Avenue.
Northbound lane, which way is traffic flowing at this point on that section of Saluda Avenue?
Saluda Avenue, it would be coming toward the camera. You see the Black Impala turns the wrong way onto Saluda Avenue, has to pull off to the side slightly to allow oncoming traffic going the right way on Saluda Avenue room in order to pass.
And so the correct lane of travel would have been where in relation to that?
It would be further to the right on the other side of this median, closer to these buildings on the right, behind this tree here. You can see it continues southward on Saluda Avenue to the intersection. And this is a zoomed in version of that same video that gives you better view as the Black Impala pulls into the intersection, or into the parking lot beside Natural Vibrations, pulls through the parking lot, and exits heading southward on the wrong direction on the one-way section of Saluda Avenue. It pulls off to the side so that the oncoming car can pass. And then it continues southward toward the next intersection.
Mr. Martin, to your knowledge, were you privy to review every single camera and every camera angle in all of 5 Points?
I do not believe I was.
And so what is the next slide depict?
This is...
Where were we just before and where are we going?
Okay. The Chevy Impala came down Hardin Street, turned right into this parking lot, and then exited left onto Saluda Avenue, heading the wrong way. And this is another camera facing northeast from the intersection of Divine and Saluda Avenue. This is the car previously headed the proper way up the northbound lane of Saluda Avenue. You can see down here in Impala moving out of the way. As it passes, it allows it to continue south on Saluda Avenue. This is Divide Street again. Comes to a rolling stop. And turns left, headed east again on Divine Street.
Approximate time at this point is what?
2:02 a.m. Comes to a stop at a parallel parking spot in between the yesterday's building and the TD Bank on Divine Street. And its brake lights turn off. It continues to sit here for approximately 3.5 minutes.
Continuously?
Yes, the lights do not turn on. No dome lights appear to turn on. The headlights don't turn on.
Does it appear as though anyone gets in or out of the vehicle during this 3+ minute time frame?
No, sir. So this is a previously viewed camera angle on the side of the yesterday's building looking west on Divine Street. The Impala has moved south on Saluda Avenue, coming out at this intersection, turning left, and coming to a stop at one of these parallel parking spots right here on Divine Street. So you'll see again, Saluda Avenue is over here.
And the vehicle ends up parking behind this line of cars somewhere, is that right?
Yeah, somewhere obscured slightly by these pedestrians under this awning here. You'll see the car come to a stop at one of those parallel parking spots. You'll see the headlights disengage. And it will rest there for about 3.5 minutes.
All right. When does the car move out from this point?
I believe it's around 2:00. This camera is about 2 minutes slow, or 2 minutes fast, I'm sorry. So it would be around 2:04 a.m. You see the headlights have turned back on. The Chevy Impala re-enters traffic, heading east on Divine Street toward the intersection of Divine and Hardin Street. Its left turn indicator is on, and it moves into the left turning lane at that intersection.
And again, you see the same features on the vehicle in terms of the rims and on the rims of the vehicle?
The shark's fin antenna. This is a previously viewed camera angle again, facing north on the side of the yesterday's building, right at the intersection. The Chevy Impala will come in from frame left. See the rims, have a lot of detail. Comes to a stop at the intersection in the left turning lane.
Does the car go straight up Divine, or does it turn left on the Hardin?
It turns north on Hardin again, followed by this blue Jeep.
Blue Jeep going to continue on behind the Impala?
It will follow the Impala north on Hardin Street. So this next one, previously viewed again at the corner of Natural Vibrations near the Bird Dog, looking northeast up Hardin Street. This video has been slowed down to 25% normal speed.
And the individual standing there in the middle of the frame?
It is the victim, Samantha Josephson. You see the Black Chevy Impala continue.
This was the last time that she was seen. This is so sad. You know this has to be killing the parents, the family seeing this. Oh boy. All right, resume.
North, followed by the blue Jeep,
This is at approximately
206, 205. When it approaches Green Street, you'll see that the blue Jeep continues north, passing the Impala on the left. The Impala turns right onto Green Street. And this is just again to show the continuity you saw before. It was being followed by this blue Jeep. And we'll use that to show continuity again shortly. This is a zoomed in version of the previous video to show indication. The blue Jeep passes on the left, the Impala turns right onto Green Street.
This is the first time that we've seen the Impala turn on Green Street, correct?
That is accurate. This camera is facing north, or southeast, mostly east, from the Breakers Bar area. There's a camera box here that faces down Green Street. You can also see down Hardin Street to some extent. This is the blue Jeep again, showing continuity. The blue Jeep passes.
I'm sorry to interrupt. Why was continuity necessary for this camera?
This camera's time is off approximately, the time indicated on here is 2 minutes slower than the time on the other cameras. We see that the Impala is turning right again on Green Street. This camera is facing south from the adjacent corner on the same intersection.
Again, the same issue here in terms of time and continuity on this camera box data.
This time is closer to the other camera box, but it's still not accurate with most of the other ones. The Chevy Impala turned east on Green Street there. This is the Chevy Impala, again highlighted. It turns right onto Green Street. It follows Green Street for approximately a block.
And that's towards Martin Luther King Park.
That's correct. It applies the brakes a few times. It turns slightly right and performs a fourth U-turn. It returns back to the intersection of Hardin and Green Street, coming to a rest at the intersection here. The light's red. Just to show that action a little more clearly, is a zoom version of the same video. Pulls eastward on Green Street. And performs another U-turn.
Once the vehicle gets back to that intersection, which direction is it going to travel?
It gets to the intersection in the left turning lane to turn left headed south again onto Hardin Street.
Back towards Bird Dog and Vine?
That is accurate. We viewed this camera angle earlier. It's facing northwest, looking down Hardin Street at the parking lot beside Natural Vibrations and the Bird Dog.
And the approximate time on this camera?
Indicated at 2:08 a.m. See here a Black Chevy Impala pulling toward the same Impala, turning back into the same parking lot.
Does it drive all the way through again this time?
This time it stops halfway through the parking lot and backs into a parking space, as indicated by the headlights flashing up against the back of the cars across the parking lot.
Are there some continuity vehicles in place here as well?
Absolutely. There's a white car, a silver car, it will be seen soon. A gray minivan follows behind, followed by the black Chevy Impala pulling out of the parking space, back into the parking lot. Gray van re-enters traffic, Chevy Impala.
And what, if anything, did you observe about the positioning of the seats in that vehicle at this point?
The driver's side seat appears to be reclined significantly. This is also, out of all of the surveillance I viewed, the time in which most light enters the cabin of the vehicle. Car turns right, headed south again on Hardin Street. This is a previously viewed angle before that we've seen already, but just a little later. It's turned slightly to the right of the video we just saw.
Now, where are we in time on this clip as it pertains to the previous clip?
This clip has started 3 minutes earlier.
So that is the same, the time on this camera is the same, linked to the same camera we just saw. We just rewind the time a little bit.
Exactly.
Okay.
This camera angle shows the full amount after the Black Chevy Impala follows behind the victim heading north on Hardin Street. It follows this red car. And it turns into Green Street. You can't see the U-turn previously shown.
So it's 206, is that right?
Yes.
And the Impala's about to pass on Hardin?
Yes, heading north right here, followed by the blue Jeep again.
Okay.
He turns right on the Saluda, or onto Green Street, I apologize. Performs a U-turn and comes back out, enters this parking lot, backs into a parking space, and re-enters traffic.
So is it fair to say that this is just showing Ms. Josephson during the time of the cameras that we previously watched a few minutes ago, the U-turn by Martin Luther King Park and all that?
Yes, sir. The next slide is two camera angles, the two that we just previously looked at, but I made a larger video canvas. Proximity of the cameras lend themselves to be put side by side. They don't match perfectly, but it is pretty close.
So you said these are the two previous camera angles we just saw, is that right?
Yes, sir. And you see a Black Chevy Impala turning left into the parking lot. The white car enters the frame, and then when he comes out, throws some garbage into the trash can. You see the Impala and backed into a parking spot on the left of the frame there. A car, silver car, tries to pull out into traffic. It's being blocked by another car in traffic. Car comes to slows down in front of Ms. Josephson. She attempts to enter it, and it pulls off.
And as she's doing that, as she's approached this silver car that ultimately pulls off after she attempted to get into it, where is the Impala during this?
The Impala is over here, still in the parking lot behind the gray minivan.
Okay. Once the Impala pulls out of the lot, which direction does it turn?
It turns right, headed south. It turns into this handicap spot right here.
What, if anything, do you observe about the Impala as it makes the turn?
It jumps the curb right here with its rear wheel, pulls into the handicap spot here, and Ms. Josephson enters.
This is so hard to look at. Wow. So hard. Wish she didn't get into the vehicle, but she didn't know. She didn't know it was going to be some Dusty Lowlife like him to do something like this to happen to her that night. Just going out having some cocktails with some friends. College students, what college students do. So sad. All right, let's get back to it.
The rear passenger door of the car. It puts the car goes into reverse. You see the reverse lights. It tries to back into oncoming traffic. Oncoming traffic passes. It attempts again to back into traffic. And it continues southward on Hardin Street. This is the only video included in the presentation that was not provided by statewide security. It was provided by the business, Bird Dog. It is their private company's surveillance video.
And that was from Stacy Exhibit number 3, correct?
Yes, sir.
Is the time the same on this video as the previous one?
The time on this video appears to be approximately 1.5 minutes fast comparatively to the last previous videos we have just watched. Samantha Josephson is sitting right here.
The entrance to the park and exit to the parking lot that we've been referencing in prior videos, can you describe where that is in relation to Ms. Josephson?
It is directly behind the way that she is standing right now, slightly to the left. The sidewalk is here. The parking lot entrance is here from Hardin Street. The parking lot is on the other side of this corner of the building.
Is the Impala about to come in frame?
Yes, sir. We will turn right into the parking lot behind her. There it is. Entering the parking lot. And again, the white car, a young lady comes out of the person trash away in the trash can nearby.
Followed by which car?
Followed by a silver car, followed by a gray minivan, followed by the black Impala.
This silver car is the one that she's going to attempt to get into, is that right?
That is accurate. See the black Impala pulling back out into traffic shortly, and it jumps its rear passenger tire on the curb, enters the handicap parking spot. Ms. Josephson enters the rear.
I know I keep pausing it. This is so chilling. That was it. This is basically the last that you seen her. Once she got in that vehicle with this monster. But she didn't know. She didn't do nothing wrong. She didn't do nothing wrong. The only thing that went wrong was Mommy and Daddy laid down and had Satan Jr. by the name of Nathaniel Rowland. That's it. All right, resume.
Passing the door. Closes the door. The driver attempts to back into Hardin Street, oncoming traffic. And pulling out into the right lane. We're headed south on Hardin Street. The next camera angle is nearby the bird dog. And it's a camera that we had previously looked at looking more southeast,
Back towards Divine.
back toward Divine. You see the headlights as the Impala pulls into the handicap parking spot. In a moment. Tends to back up and stall briefly because of oncoming traffic. And then re-enters traffic, passes this vehicle on the left, behind the silver car, pulls to the intersection of Divine and Hardin Street in the right-hand lane, comes to a stop at the stoplight. This is another previously viewed camera angle, facing north at the corner of yesterday's is on Divine and Hardin Street. You see the silver car and the Black Chevy Impala here in the right-hand lane as the light turns green. Continue southward on Hardin Street
Toward Blossom.
toward Blossom Street. This is another camera up high on the opposite side of the building on yesterday's, looking down to Santee and Hardin Street. You'll see from this angle, for continuity purposes, a delivery car with a car topper moving south down on Hardin Street, followed by a black Chevy Impala, a gray car, and a gray truck. This is another video from the Cotton Gin that we have viewed previously. This is the 5 Points area. This is moving further south on Hardin Street. The first camera we'll look at is the camera outside of Cotton Gin, and there's another camera further south on Hardin Street facing up Duncan Road. Again, you'll see,
So this camera's looking away from 5 Points towards Hardin Street? correct?
yes, this is Hardin Street, and this is the intersection of Blossom and Hardin Street. Hardin Street continues up a hill past that light. Here's the delivery car with the car topper. Here's the black Chevy Impala, gray car, gray truck again, showing continuity as it moves further south up the hill on Hardin Street.
Continuity being important on that video because the time there is
Several minutes on. This is further down Hardin Street looking at Duncan. This is Duncan Street, this is Hardin, the camera's perpendicular.
to the left on Hardin is 5 Points, to the right, is that towards the Rosewood area?
That is true, Rosewood Drive, yes sir. You can see car topper, delivery car, Chevy Impala, passes it on the left and continues south on Hardin Street. Further continuity, you'll see a gray car and a gray truck. At this point, continuity became difficult to achieve because there's not as much density of activity on screen.
Can you explain what that means?
The time of day that this occurred, there's not a lot of activity to be captured on camera. There's not a lot of cars moving around, there's not a lot of pedestrians on the street. So I was not able to find continuity in between camera angles, or necessarily use just the time stamps on the video footage to find more video related to this Impala. However, we did have access to Samantha Josephson's GPS data on her cell phone that indicated that the car had turned down here, never made it to this intersection, but had come down to Rosewood, past this public supermarket here, and then south on Kilbourne, then back east on one of these roads here, back up South Beltline up to this area, and then I could not find any other.
And you said that the car, that you did have information that traveled on Rosewood Drive, is that right?
Yes, sir.
And then you said down South Kilbourne?
Yes, sir.
And according to this map, what part of Columbia is that in?
This is the Rosewood District.
Okay.
This is 5 Points. So we've got it traveling so far to about here. And then I was able to find some additional clips based off of the GPS data from her phone.
All right.
The next two camera angles is outside of the Publix shopping center on Rosewood Drive. The first camera is facing west, the second camera is facing east. This is the black Chevy Impala here at 2:14 a.m. There's a gray SUV and a red car stopped at the intersection. Light turns green. It's a turn lane.
and all cars proceed east on Rosewood Drive. This is the Black Chevy Impala again. The next angle is opposite of that corner. You'll see all of the cars moving west. East. Oh, my apologies. Continuing down Rosewood Drive. This next camera is on South Kilbourne Avenue at the intersection of Live Oak Street.
And as we look at this map, you said the next camera is here on Kilburn, South Kilburn?
Yes.
Where is that in relation to South Ott?
South Ott Street is further to the west by, I would say, 500 feet. Oh, there it is. Yes. So it runs at an angle. It runs from northwest to southeast and then turns and runs more in a north-south orientation.
Okay.
I believe the time on this is fast by about 2 minutes. It should be closer to around 2:18. You can see it's following this car. It turns left onto Live Oak Street. That intersects with South Beltline Boulevard.
All right, and this area, South Beltline, the next camera angle is where?
So Live Oak is right here, right at the very bottom of the screen. South Beltline Boulevard runs up into an intersection with Rosewood Drive where we have 2 camera angles. Beltline continues north by Midlands Technical College.
I'm sorry, you can go back 1 second. Just to help orient where we are in Columbia, where is this as it pertains to the area where we saw the Impala coming into town on Divine Street earlier? I know it's not on the map.
Just off this map, near the Staples business right here, the cameras would be approximately on the top edge of this monitor. This is the first set of cameras that we found.
So then which direction from here would Columbia 5 Points be, and which direction would Sumter?
Columbia and 5 Points would be to the west, Sumter is to the east, 5 Points is northwest. This camera angle is facing east on the corner of Rosewood Drive and Beltline. Black Chevy Impala crosses the intersection. And then another angle looking more northward. Black Chevy Impala moving north on Beltline Boulevard.
Does it continue on to Divine Street?
It does not.
What does it do prior to getting to Divine?
We have another camera at the business of Checks Plus, outside of Checks Plus, looking northwest from the Checks Plus building, looking across Beltline Boulevard. It was driving north on Beltline Boulevard and performs another U-turn, turns south. Based off of Samantha Josephson's GPS data, I was not able to locate any more camera angles in the Rosewood area. All of the provided video that I went through had no more instances from Samantha Josephson's phone to indicate that we could find any. I looked through several of them, I was not able to find any.
All right, what are we looking at on this map?
The defendant's phone indicated that at a certain time frame, around 3:20 a.m., that the phone was traveling east on Garner's Ferry Road. This is a map of where we have 3 cameras at the intersection of Garner's Ferry Road, which is 378, and Veterans Parkway, I believe. There's 3 angles. The first view is this one, camera 2, and then camera 3 in that order.
And so to orient everyone, 5 Points. We saw Divine Street earlier, that's correct, on the
Yes.
car's way into town?
Garner's Ferry Road turns into Divine Street at the intersection of Rosewood. Divine Street continues all the way into 5 Points.
Okay, and so we're now down on the other side of that area, headed back out eastbound towards
Sumter.
Okay.
Over, you gotta stop in front.
We were just on.
Okay. And this is the car here, Black Chevy Impala, moving east. Again, from this angle, we move from frame left to frame right. And again, this camera looks east. Black Chevy Impala is headed off Garner's Ferry Road eastbound. This is the last video of the video we were provided that I was able to find the Chevy Impala.
And finally, jumping back in time, this is the bird dog video, is that right?
That is accurate.
All right. And based on your review of all the cameras that we've discussed and the cameras that are in evidence, after this camera, this time frame, is there ever another point in which Ms. Josephson appears on any camera that you know?
I was not able to see, due to the low light and all the camera angles, I was not able to see Ms. Josephson again.
This is the last time she was seen.
Yes, sir.
Okay, ladies and gentlemen, I'm going to end it right here. Next one we're going to show is going to be basically getting into the closing arguments of the prosecution and the defense, and then we got the verdict. So maybe about 2 more videos. So maybe I'll just put in 1 video. We'll see. 1 or 2 more videos. But let me pause it here. So that was the last that she was seen. Was right here getting into this low life vehicle. This is so sad. Alright, ladies and gentlemen, make sure you please hit the like if you didn't, or whoever just came in, hit the like. Watching the replay, hit the like. Also share your thoughts and opinions in the comment section. And also share the video. This is so sad. You know, prayers to her family. Prayers to her family, because I know this had to be so hard to sit up in this courtroom and see all this. How many times she was stabbed. You know, she tried her best to defend herself, but it just didn't work. You know. So back to you, Mommy and Daddy. After all of this, you don't believe it, huh? Alright, so I'm going to end it right here. Make sure you hit the like again. Share your thoughts and opinions in the comment section. And also, you know, subscribe to my channel and check out some of my past commentary. You know, feel free to do that. And if you need to contact me, you can find my email address in the description. And we'll go from there. So stay tuned for some more of Donna Just Being Real. Bye.